Hi everyone. So yesterday we have learned about the Virejana Karma and also some part of Vasti Karma. So Vasti is otherwise known as Ardha Chikitsa. So in Kaya Chikitsa, it is the half um, half part of the Chikitsa. It's very important Chikitsa in Kaya Chikitsa. Okay. So we have seen the classification given by different acharyas, such as two types, Anuvasana and Niduhavasti, the three type, Anuvasana, Niduha, Uttaravasti. And according to pharmacological action, we have seen the four type of classification. Okay, now we are going to learn about the Niduhavasti. So Niduhavasti is otherwise known as Asthabanavasti or Kashayavasti. Here, the kashaya is administered through the anal route, so that the kashaya can act on that pakvashya where the ENS is situated. This will directly stimulate the nervous system and it will result in drastic changes in the neurological diseases. That is why we are using this Niruhavasti to manage the neurological diseases. Okay. Then coming to the indications given by the Charaga Siddhi and Vakbadacharya. So you have to mark the indications given by the Vakbadacharya with the 5-star important, which means very important. You have to study each diseases mentioned in the indications. Okay. So first we have to look at the indications such as Gulma, Anaha, Buddha, Pliha, Shuddha Adhisara, Shulina, Jirna Jwara, Rejonasha, Ashmari, Daruna Anila, Amayan, Pradishyaya. So please write down the code as GAG, that is GAG, the GAG for Gulma, Anaha, Buddha, and PSA, that is Pliha, Shuddha Adhisara, and Ashmari, and DPR, that is Daruna Anila Amayan, Pradishyaya, and Rejonosha, and J, that is Jirna Jwara. So this is the indications given in the Ashtanga Hridaya. Okay. Whereas the Charagacharya mentions we can use this Niruhavasti in Sarvanga Roga, Kukshi Roga, Krimi Koshta, Shirakarnashula, and also Hridroga, Unmada, Shosha, Stamba, Andhra Puja, and Parigartika. Okay. So, coming to the contraindication, you have to study the contraindications given by the Susrutacharya. So, he mentions same contraindications for both Anuvasana and Astabana. So the diseases are where the Niruha is contraindicated is Kushta, Meha, Udara, Pandu, Shwasa, Kasa, Staulya, Shofa, Kanda Shosha, Unmada, Arojaga, Shoka, and Pipasa. So please underline the important points such as Kushta, Udara, Shwasa, Kasa, Meha, Unmada, Shoga. This is the contraindications mainly for the Niduhavasti. Whereas the Vagbada and Charagacharya mentioned the Inadisnigdha and Amadisara, Krisha, Shunapayu, Krita that is after the intake of food, and Baddha Chidroda Godara, and in Kushta, Madhumeha. In these diseases, the Niduha is contraindicated. Okay. Then the complications produced after doing the Vasti, that is Niruha, in the contraindicated ones. That is in Mukta Bhakta Pidodakam. That is after the intake of food and drinking the water. This, if we are doing this Niruha Vasti, it will cause the Vayu Vasti Utshibya, Shipram Gora Vigaran. So it causes the vitiation of Vada along with the production of Gora Vikara. And in Utklishta Dosha Mandagni, Tivra Arojagam will be produced. And in Ajirna Adhisnigdha, Pida Sneha, it will result in Dushodara, Murcha, and Shova. Whereas if we are doing the Niruha in Vamana and Virejana after the Vamana and Virejana therapy, or if the person is affected with the vomiting or diarrhea, then it will cause Sharira Kshadam and Shara Iva Dehe. It will produce a sensation, a burning sensation similar to the application of Shara. Okay. So mark the first point of 2-star important and the Vamida Virikta of 2-star important. And next is Krida Bida. Here the Vasti Urda Ubaplavet. It will produce Vasti Urda Ubaplavet. Okay. And in case of Mada Murcha, it goes Chitta Bagada and Prasakta Shardi Nishtiva. If we are doing in Niruha Vasti, it goes Vayu Vasti Urdam Nai. Okay. Then mark the point of Baddha Chidrodaga Udara of 2-star important. If we are doing this Niruha in Baddha Chidrodaga Udara, it goes Prana Himsa. Okay, Prana Himsa. And in Madhumeha and Kushta, it causes Vyadhi Vritti. Okay, increasing the persisting diseases. That is in Madhumeha and Kushta. Then coming to the Sneha Vasti, otherwise known as Anuvasana Vasti. Where the sneha, mainly the medicated oil or the gridas are used to mitigate the vada. It is known as snehavasti. So indication of snehavasti given in Charaga and Vakbada is same. That is, it can be done in those who are indicated for Astabana and in Ruksha Pragrida, Tikshna Agni, and especially in Kevala Vada Roga. So in Kevala Vada Roga, the Sneha Vasti is very, very useful. Okay. And then the indicator in those who are indicated for Astabhana Vasti are also indicated for Anuvasana Vasti. That is Astabhya Eva Anuvasya. Right. Then the contraindications given by the Vakbadacharya for the Snehavasti is Anastapya, Pandu, Kabodara, Krimikoshta, Artyamaruda, Kamala, Apachi, Shlipada, Galagandam. Okay. And Charagacharya also mentions additionally Navajara. In Navajara and in Prameha, Dushyodara, also this Snehavasti is contraindicated. So I think those who are contraindicated for the Snehapana is also comes in the contraindication of Snehavasti, and also the contraindications given in the Astabana, that is indicated for contraindicated Astabana Vasti is also comes under the contraindication of what? Snehavasti. Understood? So you have to study this indication and contraindication of 1-star important. While mainly the indication of Niduhavasti given by Susruthacharya and the indication given by Vakbadacharya is very, very important. Then coming to the complications produced if the Snehavasti is done in contraindicated person. In Navajwara, Pandu, Kamala and Prameha, the Uddara will be produced, and in Arojaga, Anna Kruddhim Hanyat. Okay. And in Abhukta Bhakta, it goes Avrada Margatvat, Urdham Vartade Sneha. If we are doing this Snehavasti without the intake of food, it goes Avrada Margata of the Sneha. Then in Pradishya and Pliha, it will goes Dosha Vriddhi, and in Mandakni and Durbala, it goes Mandatara Agni. In already Mandakni, the Agni is decreased. And in case of, if we are doing this Sneha Vasti, then it will further decrease the Agni. That is Mandatara Agni. Coming to the 9 factors which you should keep in your mind while doing the Vasti, whether it is Niruha or Anuvasana, the 9 factors should be keep in mind. What are the 9 factors? That is Dosha, Aushada, Desha, Kala, Satmya, Agni, Sattva, and Vaya, Bala of the patient. Okay. So you have to choose the medicines, the Niruha Drevya or the Snehavasti Drevya according to the dosha, Desha, Kala and Agni, well of the patient and the nature of the diseases also. That's why these 9 factors are very important. Okay. Then, according to Charagacharya, the Astabana Vasti Kala is given as it should be done in Shukla Paksha, but according to Harida, it should be done in Krishna Paksha. Okay, normally the Astabana Vasti is done in Shukla Paksha, in Shubhadin, and after digesting of the previous meal, that is Jirnana, and Egagra Manavasti. The mind should be calm and cooled. Okay, these are the indication or the time for doing Astabana Vasti. Then coming to the Vasti Vidhi, it's very important. So during the administration of Vasti Drevya, the patient should be lying in Vama Parsha Shayana, that is left lateral position. This position is very, very important. Mark this as 3-star important. That is Vama Parsha Shayana is the position of the patient while doing the Vasti Karma. So Vama Shraye Grahani Gudaha. So medicines reach directly to the large intestines. Medicines reach directly to the large intestines if the patient is lies in its left lateral position. Okay. Understand? Then the Dakshina Pada Sangujita. The patient's Dakshina Pada, right leg should be flexed and Samjato Vege Utkadagasana. After the initiation of the Vega or Vasti Vega, the patient is advised to sit in Utkadasana, that is squatting position, in order to the easy evacuation of the Mala. Okay. Then the patient are advised to take his hands and it can be used as pillow. Swabhuja Upadanam. So he can use his own hands as pillows. So these are the main things in the Vasti Vidhi. Then coming to the Niruha Vasti, otherwise known as Kashaya Vasti. So mainly it is here the Kwada is Pradana, Kwada Pradana. The Niruha Vasti is Kwada Pradana. And it can be administered without taking food. That is the specificity of the Niruha Vasti. It can be administered without taking food. Okay. Then coming to the Dharana Kala, the how much time the Vasti Dravya should be retained in the Vasti. That is 30 matra. Okay. So Dharana Kala is the 13 matra. The Vasti Dravya should be retained for 30 matra in our intestine. Okay. This is the opinion of Ashtanga Sangraha. And the Pratyagamana Kala of the Niruha Vasti is 1 Muhurta. That is 48 minutes. 3-star important. It's always asking the Pratyagamana Kala is 1 Muhurta. 48 minutes. Okay. So, while doing the Vamana, we have to wait for 1 Muhurta to initiation of the Vamana Vega. Isn't it? Like that, the Pratyagamana Kala of the Niruha Vasti is 1 Muhurta. Very, very important. Then, coming to the Samyojana Vidhi of the Vasti Drevya. Samyojana Vidhi means the order of the drugs which should be mixed while making this Vasti Drevya. So first we have to add Makshigam or honey, then Levana or salt should be added, then Sneha should be added, then Kalkam, and the last Kwada, the Kashaya should be added. So you have to by heart this line, Makshigam, Levanam, Sneham, Kalkam, Kwadam, Idikramad. That is Makshigam, Levanam, Sneham, Kalkam, Kwadam, Idikramad. It is the quote given by Vakbadacharya. So the order is first Makshigam, then Levanam, then Sneha, Kalka, last Kashaya. Here the Levana means we used Saindava. Mainly in this Panchakarma purpose, we use Saindava Levana. Okay. Then What will we do if the fecus and the urine passes during the time of administration of Vasti? What will we do? We can again give the Vasti after the elimination of this fecus and urine. Okay, again we are giving this Vasti. Then coming to the number of Niruha Vasti is given according to dosha. So for Vada, one Vasti is enough to one Vasti, yes, one Niruha Vasti. Okay, one Niruha Vasti is enough to mitigate Vada. And in Paitika diseases, two Niruha Vasti is required. And in Kabacha, three Niruha Vasti is required. And in Sannipada, three Niruha Vasti is required. So you can write the code as 1, 2, 3 as VPK. Okay. 1 star important. That point is of 1 star important. Then coming to the Paschat Karma of the Niruhavasti. This is given in Charaga Siddhisthana. The Paschat Karma, that is post-operative things that we have to do after the Niruhavasti is first Snana with the Sugoshna Jala. So the lukewarm water should be used for bath. Then after the bath, the patient is advised to eat shali annam along with the mamsarasam. Okay, the mamsarasam is added to pacify the fatigue and also the pacify the remaining vada dosha inside the body. So mamsarasa is given as Paschad Karma of Niruhavasti, 1 star point. Okay. Then Lagu Alpa Bhojana should be taken in the evening, and in order to increase the strength, as the after dinner, we are advised to give Anvasanavasti. So usually some patients experience severe fatigue after doing this Niduhavasti. Then we are advised to give the Anvasanavasti to increase the strength and also pacify the Svada dosha. And this Anvasana Vasti should be given after dinner. Okay, this is the Paschad Karma of Niruha Vasti. Then, what is the Paschad Karma of Vamana? That is Dhumapana and Payadikram. Okay, mainly Videchana Dhuma is used in the Vamana Karma. Right. So, while you are studying each and every procedure, try to remember the previously learned part also. Then it will be easy to remember at the time of entrance examination. Okay. Then coming to the opinion of Ashtanga Sangraha, the Niruha Vastikala is given as Madhyane Kinchitavrude. So it can be given in Madhyana. And the Dravya, the total quantity of Dravya should be 20 Pala medicine along with the 8 Madanaphala. The number of Madanaphala is of 1 star important. And in Niruhavasti, the Madanaphala is there. The number of Madanaphala is 8 in number. Okay. And the total quantity of drug is 20 Pala. So you can remember that with the code of in Niruhavasti, beef is added. Beef. Imagine if beef is added with the Niruhavasti. Beef here means bees. That is 20 Pala. Okay. And coming to the Vadiga diseases, we add 1/4 Sneha Dravya, and in Pitta and Swastha, we add 1/6 of Sneha, and in Kabaja, 1/8 of Sneha is added. And in Kalka, 1/8 of Sneha, that is 3 Pala is added, and in Buddha, 1 Pala is added. Okay, so mark the quantity of Kalka and Buddha. The Kalka, 2 star important, and Buddha is 1 star important. So you can write down the code as V bar 4 and P and S bar 6 and K bar 8. Okay. So this is you can study like a ratio. Okay. Sometimes the quantity of these nehas are asked in the entrance examination. How much quantity of sneha is required for the Vadiga diseases while doing Niruhavasti? Okay, so you have to study. So I think this code may helpful to you. Then, so total quantity of the Niruha Drivya that we needed is 24 pala. According to Charagacharya, the total quantity is 24 pala. Okay, whereas in Ashtanga Sangraha, it is 20 pala. Then the Charagacharya give the quantity of Kwada as 5 prasada. For it is same for Vada, Pitta and Kapha. The 5 prasada or 10 pala is same. Okay. Whereas the quantity of Sneha is 1/4. 1/4 that we have studied now with the code of V4, PNS6 and K bar 8. Okay. Then it is that is 3 pala, 4 pala and 3 pala. The quantity of sneha is equal to that of praksheba, that is 3 pala, 4 pala and 3 pala. And the kalka matra is same for all doshas, that is 2 pala. And the madhu, you can remember 3 pala, 4 pala and last 6 pala. So total quantity of the kwada is 5 prasada or 10 pala. And the sneha is 3, 4, 3 pala respectively with the doshas, and it is equal to the quantity for the praksheba, that is 3, 4, 3 pala. Whereas the kalka quantity is 2 pala for each dosha. And coming to the madhu, the quantity of madhu, it is 3, 4, 6. Okay. Whereas the Sustrodacharya mentions the need a 8 pala of kwada, and the sneha should be V4th, that is you can use the code V4th, P6 and K8. But in Swastha and Tridosha, you can mark this 2-star important. 1/5 of sneha should be used. In Swastha and Tridosha, according to Sushrudacharya, it is 1/5. Okay, very important. Then other quantities of madhu, kalka, praksheba is same as the quantity mentioned by Charagacharya. Okay. Then quantity of niruha, according to Charaga and Ashtanga Hridaya, in 1-year-old child, the quantity of niruha is 1 pala. And in second year, we can give 2 pala dosage, and 12 years, 12 pala is the dosage, and in 18 years, 24 pala is dosage. So up to 12 years, it is equal to the age of the person. Okay. Whereas in 18 years, it is 24 pala, and it is constant up to 70 years. So 18 to 17 years, it is 70. So sorry, it is 24 pala. So in adult, it is 24 pala. This is opinion of Charaga and Ashtanga Hridaya. And after 70 years, the quantities decrease. So in Ashtanga Hridaya and Charaga, it is 20 pala. And in Sustruda, it is 16 pala. Okay, 1-star important. So mainly, if the question is asking that is the quantity of Niruha, you can choose the answer 24 pala. Okay, up to 7 years. Then after 7 years, what is the quantity? 20 pala. But according to Shishruda, it is 16 pala. Then, in Hina Adiyoga of Astabana, Videjana is advised. In both Hina and Adiyoga of Astabana, Videjana is advised. Whereas in Hina and Adiyoga of Anuvasana, Snehapana is advised. Okay, 1-star important. So in Anvasana or Snehavasti, if the Hina and Adiyoga taken place, Snehapana can be done. And Hina and Adiyoga Fastabana, Videjana is advised. Okay. Then, according to Kashyapa, the Kwada, the quantity of Niruha is mentioned as the Kwada should be 8 pala and Sneha should be 4 pala. And Madhu should be 4 pala, Kalka 2 pala, Gomutram is 2 pala and Mamsa Niryuham is 4 pala. So Kashyapacharya mentions the quantity of Mamsa Niryuha. Mark 1 star important, that is 4 pala. Kashyapa is only mentions the quantity of Mamsa in Niryuha Vasti, that is 4 pala. Okay. Then coming to the Sneha Vasti, Prayoga Kalam. The Sneha Vasti can be administered the daytime during Shishira, Hemanda, Vasanta. In Hemanda, Shishira, Vasanta Kala, we can administer the Snehavasti in daytime, whereas in Sharat, Grishma and Varsha, it can be taken during night time. So you can write the code as Hey Shiva, Hey Shiva, Hey Shiva, Sneha. So a person is calling both Shiva and Sneha. Hey Shiva, Sneha. That means Hemanda and Shiva for Shishira and Va for Vasanta, and it is indicated in daytime of Snehavasti. Okay. Then the Vasti Matra of the Snehavasti, very, very important, 3-star important. That is 1/4 of the Niruha. That is 6 pala. So you have to study both the 1/4 of the Niruha, which is 6 pala. Okay, the Vasti Matra for Snehavasti is 6 pala or 1/4 of the Niruha. Then Pratyagamana Kala is 3 yama. 3 yama. 3 yama means 9 hours. Okay. So Vasti, in Sneha Vasti, Pratyagamana Kala is 3 yama, whereas in Niruha Vasti, Pratyagamana Kala is 1 muhurta, that is 48 minutes. Remember, it is very, very important. Okay. Then Dharana Kala for the Sneha Vasti is 100 matra. 100 matra. So the Sneha should be retained in the Pakvashya for 100 matra. That is the Dharana Kala. Whereas in Niruhavasti, it should be 30 matra. Isn't it? 30 matra. So Dharana Kala of Niruhavasti is less compared to that of Snehavasti, because Niruhavasti is more potent compared to that of Snehavasti. Then after Anuvasana Vasti, Tadana should be done at the buttocks of the patient. A small stroking should be done at the buttocks of the patient, so that it will cause the increasing the retaining time of the sneha. In order to increase the retaining time, tadana should be done. Okay. Then in vadadikya condition, sarvada anuvasana is indicated. So if vada is increased, then anuvasana should be done always. In Vedana Adhikya condition, Anuvasana should give after the intake of food. Otherwise, Jorolpati happens. So, if the pain is increased in a person, then the Anuvasana should be given after the intake of food. Then what will happen if the Anuvasana is given without taking the food? Jara. Jara will be produced as a complication. Okay. Then Adhiga Sneha Yukta Anuvasana. If the Anuvasana contains increased amount of Sneha, then it goes Daha Klema Pravahiga. Daha Klema Pravahiga will be occur. So you have to remember in Vadadikya condition, Anuvasana can be done anytime. Sarvada Anuvasana. In Vedana Adhikya, it should be done after the intake of food. Okay. So that's why in Grudrasi and other neurological condition where the pain is increased, especially in Grudrasi, radiating pain persists. So it should be done immediately after taking the lunch. Okay. Snehavasti can be given. Most commonly, the Pipalyadi Anuvasana Vasti are taking. So we can select the medicines according to the condition of the patient. Okay. Then coming to the Anuvasana Vasti versus doshas. In case of Vadaroga, Vilva Thailam can be given as Anuvasana. And in Pitta Roga, Jivaniya Gana Siddha Thailam can be used for Anuvasana. And in Kabaja Roga, Madana Phala Siddha Thaila should be used. Okay. So Jivaniya is mainly for Paithika disease, and Madanaphala, you can remember Madana for Kabulation, Kabaroga, etc. So you will get easily the Kabajaroga, and Vilva Taila for Vada. VV, Vilva and Vada, VV. Okay. Then Niruha Vasti and Ahara Vidhi. If the patient is of Vada diseases, if patient have increased Vada or Vadika type diseases, we can give Mamsarasa as Ahara. In Paithika disease, Shida should be added. And in Kaba diseases, Yusha should be added. Okay. Yusha should be added. Okay. What is the Anupana of Taila? Taila Snehapana. At the time of studying the Snehapana, we have studied the Anupana for each Sneha. So for Taila, the Anupana is Yusha. So I am just asking this question while I am seeing the Yusha here. So in Kabaja diseases, while doing the Niruhavasti, we can add Yusha. Okay. Then coming to the benefits of Anuvasanavasti, it goes Balaprada. It will increase the strength of the patient. And Balaprada for Vyadi, Vyayama, Karma, Adhva, Kshina, Abala, Nirojasa, Shina, Shukra. So especially the persons who is having deteriorated dhadus or ojas, we can administer this Anuvasanavasti or Snehavasti. Okay. And it goes Sthirada to Pada Janga Uru Prishta Amsa Kadi. So it will give a stability to the body parts such as Pada, Anga, Prishta, Uru. So that's why we are giving the Snehavasti in Gridrasi and in case of some shoulder disorders. Okay. Then Janayet Prajam. It's also Snehavasti is given in case of infertility cases. So Janayet Prajam. Then coming to the Adhiga Prayoga of Snehavasti, that is, the Adhiyoga of Snehavasti will produce Udklesha and Mandakni and increased Vada Vikara. So usually the Snehavasti is given for Vadiga diseases. But if it is increased or Adhiyoga of Snehavastis happens, it further increase the diseases of Vada. That is Vada Janita Vikara will be happen, and also Mandagni and Udklesha is also happening. Okay. Then coming to the Matravasti. Matravasti is a type of Snehavasti where a little amount of Sneha is used, which can be used without any Patya Karma. It can be used in any persons like Durbala, Krisha, and Bala, Vriddha, etc. Okay. So the indications for doing this Matra Vasti are Karma, Vyayama, Bara, Advayana, Adva, Yana, Stri, Karshideshu cha, Durbale, Vada Bagni cha, Matra Vasti, Sada Hidaha. 1-star important. So those who are weak due to doing more work and more exercise and due to long walking. Okay. And Stri Karshideshucha and Durbala. And in Vada Bhagnavadiga diseases also, this Matravasti is indicated. Right. Then coming to the importance of Matravasti, 2-star important, that is Yadeshta Ahara Cheshtasya Sarvakalam Niratyaya Hraswaya Sneha Matraya. Underline that line, Hraswaya Sneha Matraya Matravasti Samo Bhavid. So it can be used at any time without any restriction for any food or regimen. Okay. Niratyaha. So in Charagacharya and in Ashtanga Hridaya, the quantity of the Matravasti is indicated as 1/4 of Snehavasti. 1/4 of Snehavasti. Okay. That is Hraswa Snehapana Matra. Whereas the Sushruta indicates the Matravasti Matra as 1.5 pala, and Sharangadara as 1 or 2 pala, and Kashyapa mentioned as 1 or 1.5 or 2 pala. Okay. So mainly it is 1/4 of the Snehavasti, and according to Sushrudacharya, it is 1.5 pala. Then coming to the opinion of Chakrapani, according to Chakrapani, Anuvasana, the quantity of Anupasana is 6 pala, whereas the quantity of Snehavasti is 3 pala, and the quantity of Matravasti is 1.5 pala. 1 star important. Okay. Whereas according to Gayadasa, the Shrestha Matra is 6 pala, and Madhyama Matra of the Snehavasti is 3 pala, and Matravasti 1.5 pala. Okay, so normally the quantity of the Matravasti is 1.5 pala, or 1/4 of the Snehavasti. Right. Then, what is the difference between Anuvasana and Snehavasti? The Anuvasana Vasti can be given daily. Okay. Anu, that means daily this Anuvasana Vasti can be done. So it will not cause any other complication. Whereas the Snehavasti is indicated doing for in between 1 day gap. This Snehavasti can be given. That is the difference. Okay. So Anuvasana is of 6 pala and Snehavasti is of 3 pala. Important. Okay. You have to study this measurement, this quantity very clearly. Otherwise, it will cause confusion. Okay. Then coming to the benefits of the Snehavasti and the Matravasti are Balyam, Sugobacharyam, Srishta Purishakrit, Brahmanam, Vadaroganu, Sneha Matra Vidhanam. So this Matravasti will increase the bala of the patient and it is easy to follow. That is Sugobacharyam and Srishta Purishakrit. It will easily remove the Purisha and it is Brahmana and Vadaroganath. Okay. And all the measures are equal to that of Sneha Matra Vidhana. Then now we are going to study about the Sneha Vasti Vyabhat. Sneha Vasti Vyabhat. Yesterday we have learned about Shodhana Vasti Vyabhat. Do you remember the code for that we used for the Shodhana Vasti Vyabhat? Because the Shodhana Vasti Vyabhat is happening BC 10, isn't it? At that time, Charaga is of 15 years old and Ashtanga Hridaya or Vakbada Acharya is of 12 years. Okay. Then, coming to the Sneha Vasti Vyabhat, the Charaga mentions 6 type of Vasti Vyabhat, that is Vada, Pitta, Kaba, Atyanna, Purisha, Avrityasya, Abhukti. These are the Sneha Vasti Vyabhat indicated in Charaga Samhita. And in Vakbadacharya and Sushrudacharya mentions 8 type of Sneha Vasti Vyabhat, that is the above mentioned 6 type along with the Shunya Payu, that is Rikta Guda and Amadatta Sneha. Additionally, Charaga and Sushruta added Shunya Payu and Amadatta Sneha. Okay, then you can write the code for the Sneha Vasti Vyabhat as Sneha Vasti करके चरक चरक को व्यापक हुआ. चरक CHARAK चरक. ओके चरक स्नेहवस्ती करके चरक को व्यापक हुआ, लेकिन वासु को 8 times व्यापक हुआ. 8 times वासु को. स्नेहवस्ती मीन्स स्नेहवस्ती व्यापक के बारे में हम बात करते हुए स्नेहवस्ती करके Charak means Charagacharya mentioned Vasti Vyabhat and also 6 type Chah. Charaga Chah. Okay. Chah Vyabhat. लेकिन वासु means Vakbada and Sushruta 8 times Sneha Vasti Vyabhat हुआ. Okay. Then Let's see what are the Vyabhat. In Vadakrit, the Lakshana are Shida, Stamba, Jwara, and Angamarda. And the Chigilsa we adopting are Rasna Taila, Pittadru Taila, and then evening Anuvasana Taila. Anuvasana Vaspi is adopted. Okay. Then in Pittavada Vyabhat, the Lakshana are Jwara, Tamagashwasa, Daha, Raga, Trisha. And the Chigilsa is, we are giving Madura Tikta Rasa Yukta Niruhavasti. So mainly for mitigating the Pitta, Madura Tikta Rasa are used in Niruhavasti. Then in Kabhavrada, Tandra, Alasya, Prasega, Murcha, Glani are the Lakshanas produced, and it will cause Kashaya, Kadutishna, Ushna Sura, Gomutra Yukta Taila mixed with the Madana Phala, and Amla Kalka used as Niru. Okay. Then coming to the Annavrita, it causes Chardi, Murcha, Shula, Adinidra, and Angamarda. And for the treatment of this Annavrita, Sneha Vyabhat, the Kadu Levana, say Pajan, Muddu Virijana, and Ama Nashakriya. So mainly there will be a Amatwa, then Amahara treatment is adopted, and Pajana and Muddu Virijana with the Kadu Levana. So mark this Annavrita as 1 star important. Then in Purisha Avrita, Vitmutra Adi Gurutva Vak Sangha Atmana Hridraha will be produced. Then at that time the treatment is given as Niruha, Anuvasana, then Kramiga Vasti, Udavartanasha treatment, and Sneha, Sweda Vartiya given. So you can mark the Udavartanasha treatment in Purisha Avrita Vyapat. Then in Abhukta Sneha Vyabhat, Tada Pushta Udebhyaha. In this condition, we use Mutrashaya Trivat Siddhe. Mutra Shyama Trivat Siddhe and Yava Kola Kulatha Siddha Taila can be given for Niruha and Anvasana. And last, Stamba should be done, and also in case of Stamba and Kandagraha is produced, then Virejana is the management. So mark that point as 1 star important. That is, if the Stamba and Kandagraha are produced, we give the Virejana as the treatment in case of Abhukta. Okay. Then, according to Sharangadana Samhita, the Anuvasana Ubadrava treatment is Danyaga should be given along with the Shundi. Okay. So Danyaga should be given along with the Shundi. So I think we can stop the class at this point. So in the coming class, we will be discussed with the Niruha Vasti Vyabhat. So I am taking only small parts in each class because you have to study each in details. If make this clear in each class and study with codes. And if you have any doubt, you can ask me. And now we will have a quick revision of the Vasti from the Niruha Vasti part. And we have studied the indication of Niruha Vasti, that Gag, Buddha, Anaha, Gulma, and also PSA, Pliha, Shuddha, Disara, Ashmedi, and JNJ, Jirnajwara, and Darunanila, Pradishya, and Rajonasha. That's DPR, very important. And the contraindication given by Sustrudacharya is also very important. In Kushta Meha, Udara, Shwasa Kasa Staulya, Kanda Shosha, Unmada, Arojaga, Shosha, Shoga, Pibasa. Okay. Then coming to the complication, in Bhukta Bhakta Pidodaga, the complication is produced Vayu, Vasti, Utshipya, and Gauravikaran. And in Vasti Virikta, it will cause Sharira Kshada and Shara Ivadahet. And in Krida Pida, Vasti Urda Ubaplavet. And in Baddha Chidrodaga Udara, Prana Himsa will be happen. Then we have studied the indication of the Sneha Vasti, that is Astabhya Eva Anuvasya and Kevala Vadaroga. And the contraindication as given by the contraindication of the Astabana Vasti, and also the Pandu, Kabodara, Krimi, Koshta, Prameha, Uristamba, Galaganda. Okay. Then we should keep 9 factors while doing the Vasti Karma, that is Aushada, Dosha, Desha, Kala, Satmya, etc. Then the Astabana Vasti Kala is mainly Shukla Paksha. According to Harida, it is Krishna Paksha. And the Vasti Vidhi, the patient should be lied in left lateral position in order to reach the medicine directly to the large intestine. Okay. Then the Dharana Kala of Niruha Vasti is 30 Matra, and the Pratyagamana Kala is of 1 Muhurta. And the Samyojana Vidhi is Makshiga, Lavana, Sneha, Kalkam, Kwadam, Iti Krama. This is the order of mixing the Vasti Dravya. Then Lavana used here is Saindava. And then according to Ashtanga Hridaya, the Vasti Kala for Niruha is Madhyane, and the Dravya is 20 Pala. For Vada, it is for 1/4, and Pitta 1/6, Kaba 1/8. And we have studied according to Charaga, the Kvada quantities remain same, that is 5 Prasrudha or 10 Pala. And for Shuddha, it is 8 Pala. Okay. And also 1/5 is the quantity of Sneha required for Tridosha and Swastha according to Susutacharya. And total quantity required for an adult is 24 Pala for Niruha Vasti. And after 70 years, it is 20 Pala. And it is 16 Pala according to Susutacharya. And coming to the Sneha Vasti, the Pratyagamana Kala is 3 Yama. And its quantity is 1/4 of Niruha, that is 6 Pala. And the Dharana Kala is 100 Matra. And Matra Vasti, its quantity is 1/4 of Sneha Vasti. It is Hraswa Sneha Matra. Okay, then Anuvasana quantity is 6 Pala, Sneha Vasti is 3 Pala, and the Matra Vasti is 1.5 Pala, very important. Then coming to the Sneha Vasti Vyabhat, it is 6 according to Charagacharya, and according to Vakbada and Sushruta, it is 8. Okay, so these are the important thing you have to study. Okay. Then in the next class, we are continuing this, continue with the Niruha Vasti Vyabhat. Okay. So if you have any doubt, you can ask me anytime. Okay, thank you.